Hello, my name is Ngoc. Next to me is An, then Thong, finally is Truong. Today we are talking about tuberculosis. Tuberculosis is caused by Mycobacterium tuberculosis. It is a non-motor rod-shaped bacteria and obligate aerobe, which means it needs oxygen to grow. That is why it usually grows in lung and it grows slowly in culture media about 15 to 20 hours and resists drying. That's why it survives longer out of the body and it easily spread from person to person through the air. Fortunately, tuberculosis is curable and preventable, and it is one of the 10 causes of death worldwide. According to WHO, there is about 10 million people vary with TB and about 1.3 million people die from the disease. And it is a leading killer of HIV positive people. Look at this figure. Most of TB cases happen in Asia and Africa, and India is the country that has the highest TB cases.
Okay, now I'm gonna focus about the TB cases in our country. Here's the map that report the cases within our USA. As we can see, most of the cases occur in South America, such as California, our state, Texas, and Florida. Fortunately, the cases decrease within the history. This is reported by the CDC department, and this is the graph showing the reducing of the cases from 1992 to 2017. I'm going to talk a little bit about how the bacteria enter our body. So basically it's going to transmit by inhalation of aerosol containing the tuberculosis. It begins at the alveoli. The bacteria enter the lungs through the sacs, and in there our macrophage start to engulf the bacteria. Instead of fighting, the bacteria start to reproduce and grow within the macrophage, and eventually it's going to kill our immune cells. Tuberculosis also transmitted by the bloodstream. They can spread throughout the body and set up many foci of the infection, all appearing tiny white tubercles in the tissues.
And now I will talk about two phases of the infection. First of all, it's a primarily TB infection. It's initial infection after the bacteria enter the lungs. The symptom can be very mild or even asymptomatic. It's usually similar to the flu symptom. One important thing to note about is that people who initially got infected do not spread the disease. However, for those who have the deficient or impaired immune system, especially for HIV patient, TB can rapidly progress to secondary infection. And now the symptom can include frequent cough, weight loss, fatigue, and fever. Inflammation and necrosis in the lung can be due to the production of bloody sputum. And ones who have secondary infection can spread TB to the others. And the mortality rate is about 60% if untreated.
Now we are talking about the diagnosis. There are two tests for the screening TB. First is the skin test. That means the patient had to go to the clinic 2 times. The first day, they will be injected into the skin, and they will come back to the clinic to measure the level of the reaction. But this test has disadvantages because it's positive for the patient who received the TB vaccine BCG for years ago. So the second screening test is preferred is the blood test. It is the interferon gamma release assay. And when it's positive, that means the patient is under the latent period or under the active disease, the TB. If the patient is positive, either one of both tests, they will be conducted with the chest X-ray or grow in culture. Now we talk about the treatment for susceptible TB. The first line of the therapy is the combination of phosphorus, isoniazid, rifampicin, ethambutol, pyrazanamide for the period of 2 months intensive, followed by 4 to 7 months. That means the total time for the treatment is 6 to 9 months. For the resistant TB, besides the first line we mentioned above, the patient has to use by oral the fluoroquinolone plus at least one of the injection amikacin, kanamycin, or carbamazepine.
And now I will talk more about the prevention. So the disease BCG, as mentioned above, is available where the tuberculosis is endemic. And to prevent it, washing hands and wear masks to cover the mouth or cover the mouth while coughing can be done to easily prevent the disease. And as we can see, TB is very dangerous for those who have immunodeficient and can be easily transmitted through the air. It is important for us as the caregiver to be tested for TB and has an appropriate prevention and treatment before coming into the hospital environment to protect ourselves and also to protect the patients. And that's it for now. Thank you for listening and bye.